In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's going on, everybody? Welcome to the Abuki Cabal Show. I'm your host, Rodney. I want to thank all you guys for hanging out with me and exploring some of the information that's out here concerning COVID and my attempts to try to help everybody make informed decisions so that we can all stay healthy and get back out to some semblance of normality in life. And tonight, I guess I wanted to delve into some of the conversation about COVID-19 and its effects on male fertility. And picked out a couple of articles that I thought were interesting, and we'll take a look at some of those. Thank you all you guys for your comments on the last video. I'm going to try to cover some of those as well. You guys had some questions, and I'm going to get to those. Now, you guys feel like some of you guys feel like my coverage is a little one-sided, probably because I purposely do not take information from non-reputable sources. I only use reputable sources and scientific data, statistics that are collected in the right way. So I do not participate in the misinformation campaign that's going on, the propaganda with regard to trying to sway people from getting proper health care and proper health care information and patient education. So with that being said, we'll go ahead and we'll get on into this. Okay. This is a article, as you can see from the conversation. It's an academic journal that deals with a lot of different topics. This one in particular is about COVID-19 could cause male infertility and sexual dysfunction, but vaccines do not. Okay. Contrary to myths circulating on social media, COVID-19 vaccines do not cause erectile dysfunction and male infertility. What is true, SARS-CoV-2, the virus that causes COVID-19, poses a risk for both disorders. Until now, little research has been done on how the virus or vaccines affect the male reproductive system. But recent investigations by physicians and researchers here at the University of Miami have shed new light on these questions. The team, which includes me, I guess we'll see who that is at the bottom, has discovered potential far-right. Oh, it's Ranjith Ramsey is the author of the article. Okay. Said he has discovered potential far-reaching implications for men of all ages, including younger and middle-aged men who want to have children. So here we have a group who are not older individuals who are going to have some adverse effects from being infected with this virus. Yet you hear time and time again people talking about, pretty much they're old people and so what, old people die, and all kinds of insensitive comments that have been made that are unfortunate. Kind of shows where we are in society now. But that's another topic. Okay, what the team found. I am the director of the reproductive urology program at the University of Miami Miller School of Medicine. My colleagues and I analyzed the autopsy tissues of the testicles of 6 men who died from COVID-19 infections. The results: COVID-19 virus appeared in the tissue of one of the men. Decreased numbers of sperm appeared in 3. Another patient, this one survived COVID-19, had a testes biopsy about 3 months after his initial COVID-19 infection cleared up. The biopsy showed the coronavirus was still in his testicles. Our team also discovered that COVID-19 affects the penis. An analysis of the penile tissue from 2 men receiving penile implants showed the virus was present 7 to 9 months after their COVID diagnosis. Both men had developed severe erectile dysfunction, probably because the infection caused reduced blood supply to the penis. And this is a part of that cytokine reaction that we talk about. And it's a massive inflammatory process which causes clotting and disruption of blood flow to tissues. Notably, one of the men had only mild COVID-19 symptoms. The other had been hospitalized. This suggests that even those with relatively light cases, a relatively light case of the virus, can experience severe erectile dysfunction after recovery. These findings are not entirely surprising. Testicles. After all, scientists know other viruses invade the testicles and affect sperm production and fertility. One example, investigators studying testes tissues from 6 patients who died from the 2006 SARS-CoV virus found all of them had widespread cell destruction with few to no sperm. It is also known that mumps and the Zika virus can enter the testicles and cause inflammation. Up to 20% of men infected with these viruses will have impaired sperm production. A new study on vaccine safety, additional research by my team, brought welcome news. A study of 45 men showed the Pfizer and Moderna mRNA vaccines appear safe for male reproductive system. This then is another reason to get vaccinations, to preserve male fertility and sexual function. Granted, the research is only a first step on how COVID-19 might affect male sexual health. The samples were small. Studies should continue. Still, for men who have COVID-19 and then experience testicular pain, it is reasonable to consider that the virus has invaded the testes tissue. Erectile dysfunction can be the result. Those men should see a urologist. I also believe the research presents an urgent public health message to the United States regarding the COVID-19 vaccines. For the millions of American men who remain unvaccinated, you may want to again consider the consequences if and when this highly aggressive virus finds you. One reason for vaccine hesitancy is the perception among many that COVID-19 shots might affect male fertility. Our research shows the opposite. There is no evidence the vaccine harms men's reproductive systems, but ignoring the vaccine and contracting COVID-19 very well could. Okay, there's that article. And I have another one here. And this is a study, COVID-19 male fertility, taking stock of 1 year after the outbreak began. Okay, So this study is summarized, but I'll attach it so you guys can read it. But I'll go ahead and I'll read the short abstract of it. The objectives of the study. The aim of this review is to summarize, following a timeline, the current knowledge regarding the effects of SARS-CoV-2 virus on male fertility, researching the pathology and clinical results of the study published in the last year. Methods. A systematic research was performed on the majority of international online database. 35 articles were selected. Results. A statistically significant reduction in testosterone levels and sperm quality in subjects with COVID-19 has been highlighted in several papers. However, in many cases, the tests have been conducted in patients with active disease and long-term consequences are still not known. Some of the studies have confirmed the presence of the virus in the testes in a low percentage of patients. Viral presence in sperm has only been found in one study. Testicular discomfort, which could indicate viral orchitis, was highlighted in several works, with an incidence of up to 19% of the patients. The presence of the inflammatory lymphocytic infiltrates, IgG, and inflammatory cytokines have been documented in several works. Pathological signs of inflammation were found in 60.9% of the testicular biopsies performed in one study. The entry of the virus into the testes cells, both stromal and seminal cells, appeared to be angiotensin converting enzymes as ACE2 mediated, as it also occurs in other tissues. DNA fragmentation, reactive oxygen specimens, formation, autoantibody production, and ACE2 mediated effects have all been hypothesized as cause of cellular damage. Conclusions. The results on the effects of the COVID-19 infection on the male reproductive system are currently insufficient, as they are based on a small number of patients and therefore are often contradictory. Certain mechanisms of testicular damage are still to be assessed, as any risk categories like age, ethnicity, or others. As for the transmission of the virus through sperm, there is insufficient evidence to ensure that this cannot happen. So they're saying that essentially they need more data, but what they have is showing indications that damage is occurring in some areas really high, some areas lower, but there is definitely an inflammatory process going on that is causing damage to testicular and penile tissues. Not something that you want in a young population that is already having issues with male fertility, birth rate problems, if you look into that. So this could be a problem that adds to an already existing problem that we don't need. So I will attach that as well. And there are some other papers down here. They put the papers in succession, older papers to newer papers. You always want to read the latest paper. And the National Library of Medicine is a good tool for you guys to look for whatever you want to look for. You can search right here, and you can find whatever you want to find. Excuse me. Okay, I'll add a third paper that, is from Houston Methodist. And it's pretty short. Let's see when this one was written. Okay, this was August 2021. I won't read this one. I'll just attach it and let you guys go ahead and read that. I hope you find it interesting. And It is definitely something that needs to be looked into. I hope you guys enjoyed the program, and I will see you guys tomorrow.
You are listening to Abuki Cabal, the analytical savage.
You guys please like, share, and subscribe. Again, I'm trying to get to 1,000 subscribers. I'm close, but not quite there yet. But I'm getting quite a few views. And if you like the content and you want me to continue, this is just one of the topics that I'll be covering. I won't be doing everything on COVID. I'm just pulling out the information as it comes. It's coming in little by little every day. So I try to keep that going. I don't have as much time as I would like because I'm also working. So I have to get it out as I have time to. And usually that's when I come in from work at night. So again, I appreciate everybody for listening. And I'll see you in the next show.
I feel like a motherless child, a long way from home, a long way from